Okay, so I watched 5 Joseph Cipriano videos and here's what I learned.
Alright, no more beating you up.
Pretty freaking extreme. The world of YouTube chiropractic is a strange beast. Honestly, I can see why people love watching these videos. The visceral sound effects and hands-on chiropractic approach is simple, exciting, and typically the patient's quality of life really does seem to improve. Sometimes dramatically, at least as long as they're in the chiropractic office, that is.
This has been the only thing that has given me any relief. And I'm sorry I'm so emotional, but this is, dude.
Someone walks into a room feeling bad, Cipriano works his magic, and they leave feeling a massive sense of relief. But no matter how alluring or cathartic this seemingly instant fix might be, healing is more complicated than that. It requires an active, progressive approach that scales over time to match the patient's progress.
I call it the hallelujah stretch because you're on hallelujah.
Not a passive one-size-fits-all approach as we see in many of these chiropractic videos.
Oh yeah, maybe don't do that again.
Most people have either experienced some form of physical trauma and or have habits or a lifestyle that leads over a long period of time to their pathology. Whether their pathology is caused by trauma or lifestyle, when it arrives, patients have developed a sort of momentum in the direction of a certain pathology. And comparatively, a passive adjustment by a chiropractor doesn't carry the same amount of momentum in the opposite direction towards healing. It is important that healing modalities do 2 things. Assess accurately the severity of the pathology and the factors contributing to it, so that patients know that they won't undo a lifetime of poor motor patterns or reverse a serious trauma with a few trips to the chiropractor. Put the patient in an active role where they begin to actively chip away at their healing, feeling into the resistance as they work systematically to correct their pathology. Now, I'm not here to argue with firsthand experience. If you love chiropractic adjustments, more power to you. But there are just a few things I want to point out about the practice that strike me as odd. First of all, Cipriano seems to treat most patients with a similar routine no matter what their pathology. In the videos I watched, there was a man who was rendered paraplegic after an ATV accident. A first-time chiropractic patient diagnosed with MS and suffering from severe headaches, and suffering from severe headaches, and suffering from severe headaches, and suffering from severe headaches. A woman suffering from extreme pain in her hips and neck.
Oh, jeez.
A man with severely restricted neck movement.
Oh, gosh.
And a young man with some ribs out of place. Are you getting the picture? When all you have is a hammer, everything starts to look like a nail. People come to see Joseph Cipriano for a myriad of reasons, and he treats them with an approach that seems a little too one-size-fits-all for my taste. To illustrate my point, I specifically chose patients whose conditions warrant variation in treatment methodology. And I've only chosen clips that highlight some of the similarities between them. There are many more mainstays to his treatment approach, and the similarities between cases, regardless of their pathology, is eerie. And of course, he finishes pretty consistently with the dramatic Y-strap finale. Whoop, pow! A must, since he is the Y-strap chiropractor. It almost feels like I'm watching some kind of performance. It's frustrating to see, actually.
Bringing out the strap, huh?
Oh, yeah.
Oh, boy. Oh, my God.
Especially when some of these movements facilitate anatomical patterns that can and should be achieved actively by the patient to create longer lasting results. What we just saw was Cipriano moving a patient into a passive backbend. Backbends directly counteract the slouching posture that many of us sit in all day, lengthening and relieving tension in the spine. Only when they are facilitated passively, we do not have the opportunity to strengthen the muscles that support our spine in the optimal position, like a Superman hold or a yoga bridge pose might. Now, I'm sure you're aware that the spine plays a central role in overall health. It is our body's central support structure. It keeps us upright and connects the different parts of our musculoskeletal system to each other. Inside the spinal column, the spinal cord conducts nerve impulses between the brain and the body, enabling you to feel sensations and move. Without it, you're dead. It is no surprise that improving spinal health can have far-reaching positive effects across the whole body, but chiropractic seems to take this to the extreme. The spinal nerve at the level of each individual vertebrae is associated with specific functions of the nervous system and motor movement. Thus, it is feasible that releasing the mechanical tension around specific nerve bundles could address specific pathology, or at least conceptually. But the spine of your average chiropractic patient is likely misaligned or subluxated to a very subtle degree, if at all.
I'm going to pull out a mustache hair and I'm going to place that hair under the first page of the phone book. I want you to find the hair. Because if you can't, you have no ability to feel a little twinge caused by back pain.
My back hurts all the time, especially in my neck.
Oh! As Professor Stuart McGill of the University of Waterloo, Canada points out, just feeling these subluxations or misalignments is a feat of incredible skill, and they require subtlety and precision to manipulate effectively.
But a skilled clinician can just romance that joint and produce the effect.
He goes on to mention that some spinal decompression methods deploy blunt force, lacking specificity compared to other more subtle methods. He mentions a decompression machine to be one of these methods, but I get a similar feeling from some of the things Joseph Cipriano does. What's going on here doesn't seem to target anything all that specific. Even in some of Cipriano's more specific cracking maneuvers, he appears just to work his way down the spine in a linear fashion, cracking the whole spine bit by bit.
Not as much of a thrust, but...
The wildest part about that particular patient is that he's had a spinal fusion from T6 to L1. That's mid-thoracic all the way down to the first lumbar vertebrae lower down. So 6 vertebrae in his mid-back have been fused into an unmoving segment with surgical hardware. This procedure restores stability to a section of the spine, but severely limits mobility. Once it has been fused, a chiropractor can no longer manipulate the spine in this region. Thankfully, Cipriano lessens the pressure of his adjustments as he moves through this region, but he's still adjusting the man where the fusion has occurred, similarly as he does someone without a spinal fusion, for no real reason. This was the woman with severe hip pain, and the approach looks pretty similar. Only he's working his way from bottom up, not the top down. And I'm sure you noticed the interesting table, which he raises up, then drops into position with every back crack. This is a chiropractic drop table. In the 1950s, a chiropractor named Dr. J. Thompson broke the headpiece of his adjustment table so that it moved slightly when he adjusted his patients. He found that the recursive movement helped to facilitate adjustments, and he modeled a new table with droppable parts. The mass of the patient and the force of his adjustment work in tandem with the swift top of the table, allowing Dr. Thompson to transfer more energy into each adjustment and into the patient's spine. Dr. Philip Cordova, a Houston chiropractor, points out that this is helpful when adjusting patients who cannot be adjusted by twisting in an upright motion.
And so because of that, this special table has been invented that lifts up and that we push down, and we're able to get an adjustment without having to twist them.
Sounds like another application of blunt force to me, and an added component of movement that no doubt lessens the specificity of each adjustment. But it is nowhere near as blunt a tool as the famous Y-strap.
Breathe. Breathe.
So, can we book you for a follow-up, or... But for real, I want to know what this is supposed to be doing. Like, really, what is this supposed to be doing? So I went straight to Joseph Cipriano's website to find more information on the goals of the so-called adjustments. It reads, the Y-axis traction strap corrects kinks in the epipia collagen network. The cartilage and the collagen of the joint capsules are shortened and strengthened on the acute angle side of the deviations, making correction difficult unless stretching and time-dependent procedures are used. Come again? Talk about freaking word salad.
Oh my God! I don't know if that's supposed to do that.
Okay, Let me break this down for you. The brain and the spinal cord are enveloped within and protected by 3 layers of connective tissue membrane known as the meninges. The outermost membrane is the dura mater, formed of dense connective tissue. The second is the arachnoid matter, a sheet of connective tissue which creates a spongy subarachnoid space. The innermost is the pia mater, which lies directly on the surface of the brain and spinal cord and aids in the production of cerebral spinal fluid.
You're driving along, and then what happens is you crash into the trees. What stopped the man from hitting the tree? His car. What stopped the man from hitting the car? His seatbelt.
Cipriano is talking about manipulating the epipele portion of the deepest layer of the meninges and the collagen fibers located there.
There's our passenger, there's the car, and there's the seatbelt.
Specifically on the acute angle side of spinal deviation. So wait, we're manipulating a layer of connective tissue that is indistinguishable from the shape of the spine since it envelopes it completely. And we're targeting a very specific aspect of it by yanking our patients' heads sharply away from their body. Come on, man. I'm not really sure the difficulty involved in targeting this pia mater can be overcome with such a blunt force technique. Nor does the application of quick, sharp force necessarily lead to lasting changes in mechanical spinal patterns. In all likelihood, the spine and the associated meninges will revert back to their pre-manipulation position, if not immediately, then over time. Especially because the supporting musculature has not been strengthened in the procedure, and it's unlikely the patient's movement patterns have changed as a result. Unless in the split second it takes to yank the patient's neck, the muscles undergo some progressive strengthening procedure as well. So with questions about the efficacy of this technique forming in my head, I clicked the Learn More button and, well, it doesn't take you anywhere. The anatomy of the epipele layer of the pia mater is intertwined completely with the overall anatomy of the spine. And anything you do to the spine will have some effect on the pia mater. They're freaking attached. Any claims of greater specificity are unfounded. The claims that patients may feel the release from the suboccipital region of the skull down through the cervical, thoracic, and lumbar regions of the spine from the Y-strap adjustment, and that where one is most out of alignment is where the effect is felt most is equally nonsensical. The suboccipital region of the skull down through the cervical, thoracic, and lumbar regions. You mean the entire spine? By golly. We've discovered the magic cure-all, and it starts with a Y. I have to rethink my entire clinical practice. Headache? Y-strap. Broken wrist? Y-strap. Heartbreak? Y-strap. Can't walk? Y-strap. Erectile dysfunction? You guessed it, Y-strap. Fine, I'm exaggerating. But perhaps a little hyperbole is warranted. At the end of the day, I want the people of the world to be healthy, to understand how best to improve their health, and how to identify methodologies that may not be worth the hype. Because remember, when all you're carrying is a hammer, everything starts to look like a nail. If you liked the video, be sure to subscribe. And if you didn't, let me know why in the comments down below. As always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, and teach one.